It is now with great pleasure that I introduce you to today's commencement speaker, Mark Johnson. A little bit about Mr. Johnson. Mark is an emergency medicine and hospital medicine physician assistant with over 20 years of experience working in the ER and hospital setting. His passion is to improve the care of patients by improving the support of healthcare workers. His particular interests are healthcare worker wellness and burnout prevention, addressing the opioid crisis and improving sepsis care, and engaging advanced practice providers in hospital practices. He founded the PA for Life blog in 2021 and has collaborated with experts to discuss topics such as burnout after the COVID-19 pandemic, compassionate care for patients with addiction, addressing shame in medicine, and finding meaning in our practice. When Mark is not working, you can find him spending time with his family, hiking with his dog, or wading in a Missouri stream fly fishing for trout. Please join me in welcoming to the podium Mark Johnson.
Yeah, I'll just give you a short version of that. I'm an Iowa boy who gets nervous about this St. Louis traffic, but I actually made it through it. Anyone else not like this St. Louis city? I'm still an Iowa boy. Well, it's an honor to be here today, and congratulations to each of you on this special day. I will try not to bore you with any boring stories, but I think I have a message for you that could change your practice. But first, I want to talk to you about what Tammy had to say about your class. And she had some wonderful things to say about you. She acknowledged how each of you has persevered despite many different challenges. Many have worked full-time while completing a very challenging and accelerated curriculum. Some of you have had to balance your studies with caring for your family members, many of whom are here today. And of course, the unprecedented challenges of the COVID-19 pandemic. There are the scary parts, those early days when we were worried about the guy in the room, we're not sure if he could have COVID. Because the hard part is you couldn't tell. The guy over here with the sniffles could have COVID, and the one that looks really sick might not. And when we heard of our co-workers dying from this, it was a real fear for many of us. And we also saw some of the sickest patients of our career. Of my 20-year career, I've never seen sicker patients. And it was difficult to see those patients come in and die within moments of arriving to the emergency room. Now, that's the scary parts. The funnier, more comical parts were when we were all trying to decide, do we wear 2 or 3 masks? Or what order do we put on the PPE? Do we put on this first or that first? Because you got to get that right. And how in the world am I supposed to see with these fogged up glasses? And my favorite was when you're at the nurse's station and somebody coughs or sneezes and everyone slowly backs away. During your career, you will have many defining moments. These are the moments you remember, whether good or bad, and they change your practice and your perspective. Today, I'd like to spend a few moments to share a few of my defining moments. I recall the time the 65-year-old gentleman came to the emergency room and family said, he's got a kidney stone, we've all had them. I was working in the fast track, they asked me to come over and just help out in the main ER. Found a gentleman who was diaphoretic, sweating, low blood pressure, and he appeared sicker than your typical kidney stone. I decided to send him to CT immediately to rule out something called a ruptured AAA. The veteran nurse I was working with rolled his eyes a little bit because I was a fairly new PA at the time. But a few minutes later, as he walked this patient back, he said, "By golly, Mark, I think you're right." Needless to say, my concerns were confirmed. He had a ruptured aortic aneurysm. We had him emergently flown to Des Moines Hospital, and he survived. A couple of weeks later, he came back to our hospital. We hugged, we shed a few tears, and I thought, this is why I got into medicine. I also remember, years later, a middle-aged man who came to the ER with ear pain and vomiting. It was during flu season. Everyone was coming in with vomiting, cold symptoms. We gave him some IV fluids, but a few hours later, after 2 layers of fluids, his heart rate was still elevated, and his blood pressure wasn't going up the way we thought it should. We decided to obtain an EKG and discovered that this patient was having an inferior myocardial infarction. And those non-medical folks here, he was having a heart attack without the typical crushing chest pain symptoms. In this case, I didn't think vomiting and ear pain represented that, but I learned a lesson that day. Needless to say, the patient went to the cath lab. The next day, I called to check how he was doing. It was Thanksgiving Day. They told me he had died. This news was devastating to me, and I think it was the most difficult Thanksgiving of my life. I spent the weekend pondering what I could have done differently to save this patient. I questioned my competence. I even asked God how he could have allowed this to happen. Fast forward to just a few years ago, I was working in hospital medicine and saw a kind elderly gentleman with acute kidney failure. Actually, he had chronic kidney failure, but it was getting worse. This guy had every reason to feel sorry for himself, but he had, for some reason, was more concerned about how I was doing. I finished my physical exam and he asked me, "Can I pray for you?" And he handed me a small wooden cross. I think I shed a few tears, and as he prayed, I thought, little does he know that I'm dealing with the stress of COVID-19, and he also doesn't know that my wife had just had emergency surgery and is on another floor of this hospital being cared for. That day, I needed that prayer. These moments, whether good or bad, change our perspective and view of life. They form us as individuals. They change our way of practicing. The first thing people ask me is, what's the craziest thing you've seen in the ER? Well, you really want to hear about that. I could tell you about the foreign bodies found in the craziest of places. You might know what I mean. Or the patient who came in for abdominal cramps, only to realize she was pregnant and about to deliver her baby. Or the many amputations, lacerations, abscesses, and crazy surgical cases. Isn't this why we all got into medicine? We want to see the cool stuff. We want to make a difference in someone's life. We want to be part of positive change. It is often how we define our success. Yet today I would submit to you that true success in your career should not be defined by these big moments, but rather by the small moments. It's the time you take to tell your suffering patient that you're going to do everything you can to relieve their pain. It's wrapping your patient in a warm blanket. Anyone ever felt that before? We call it the ER hug, wrapping them up that way. It's also the reassurance and hand on the shoulder of the anxious patient who is heading into the emergency room, or maybe that one that just got a diagnosis of a terminal disease. And maybe it's the silly faces you make to the pediatric patient who is so apprehensive, yet you put her at ease with your calm demeanor. I'll close today by telling you about one particular pediatric case. This 6-year-old boy presented to the hospital extremely weak and unable to walk. His parents told the staff he had developed blisters on both palms after showing off on the monkey bars at school. He actually became quite ill. A few days later, was diagnosed with strep throat. However, he continued to have high fevers, diarrhea, vomiting, and severe weakness. By the time he went back to the hospital, he was in critical condition. He was admitted to the pediatric intensive care unit where he was diagnosed with toxic shock syndrome, a rare and life-threatening disease. This is more often associated with women and tampon infections, but in this case, the blisters create an environment for this syndrome to develop. His parents were told that he may only have 24 hours to live. He was one of the first pediatric cases of toxic shock diagnosis in the state of Iowa. I know about this case because I was that patient. And it was because of that experience that I decided to seek a career in medicine and why I stand before you here today. I also tell you this story because while it was the doctor who made the diagnosis and ordered the appropriate treatment, It was the nurses I remember the most. As layers of skin peeled off my body from this terrible illness, it was the nurses who got me special slippers to wear so it wouldn't be painful for me. When I had absolutely no appetite and my kidneys were failing, but finally wanted something at 2 a.m., it was a nurse who brought me the only thing I wanted to eat, a cup of ice cream. And this is probably why I still eat ice cream nonstop to this very day. It was a nurse who comforted me on the nights when my mom had to go to work, and I sobbed because I didn't want her to leave. But I remember the nurse hugging me and saying, "It's going to be okay." And even at the age of 6, I could tell when a nurse was listening to me and had a passion for her work. It poured out in his or her actions and words. It was those seemingly small moments that made all the difference in my life. They are the moments that you may never get recognition for, nobody may ever see. They will never show up in your metrics, your compensation, or a survey. Yet I hope they are what defines your career. This, my friends, is how I would measure your success. Arthur Philip Brooks said it this way: character may be manifested in the great moments, but it is made in the small ones. As we celebrate your accomplishments today, take time for the small moments, cherish them, reflect on them, live in the moment. I wish you all the very best, and thank you for your time.
Thank you, Mr. Johnson, for those inspiring words to our graduates.